Understanding blood pressure. Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps blood through the body. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed as two numbers, the systolic pressure and the diastolic pressure. The systolic pressure is the top number and represents the pressure in the arteries when the heart beats and pumps blood. The diastolic pressure is the bottom number and represents the pressure in the arteries when the heart is at rest between beats. Normal blood pressure is typically considered to be around 1/128th of a millimeter of mercury, with systolic pressure less than 120 millimeters of mercury and diastolic pressure less than 80 millimeters of mercury. High blood pressure, or hypertension, is defined as having a systolic pressure of 130 millimeters of mercury or higher, or a diastolic pressure of 80 millimeters of mercury or higher, consistently over time. 10 superfoods that may help lower blood pressure. Leafy greens, such as spinach, kale, collard greens, and Swiss chard, are high in potassium and magnesium, which have been shown to help lower blood pressure. Berries, such as blueberries, strawberries, and raspberries, are high in flavonoids, which may help reduce blood pressure. Fatty fish, such as salmon, mackerel, and sardines, are high in omega-3 fatty acids, which have been shown to help lower blood pressure. Beetroot contains nitrates, which may help relax blood vessels and lower blood pressure. Garlic is high in a compound called allicin, which may help lower blood pressure. Avocado is high in potassium, which may help lower blood pressure. Dark chocolate contains flavonoids, which may help lower blood pressure. Pomegranate contains antioxidants, which may help reduce inflammation and lower blood pressure. Tomatoes are high in lycopene, which may help lower blood pressure. Walnuts are high in omega-3 fatty acids and other nutrients that may help lower blood pressure. 10 lifestyle changes that may lower your blood pressure. Here are 10 lifestyle changes that may help lower blood pressure. Exercise regularly. Physical activity can help lower blood pressure, and it is recommended to aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Maintain a healthy weight. Losing weight if you are overweight or obese can help lower blood pressure. Follow a healthy diet. Eating a diet that is rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy products and low unsaturated and trans fats, added sugars, and sodium can help lower blood pressure. Reduce sodium intake. Consuming too much sodium can raise blood pressure, so it is recommended to aim for no more than 2,300 milligrams of sodium per day or even less if you have high blood pressure. Limit alcohol intake. Drinking too much alcohol can raise blood pressure, so it is recommended to limit alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Quit smoking. Smoking can damage blood vessels and raise blood pressure, so quitting smoking is important for lowering blood pressure. Reduce stress. Stress can raise blood pressure, so it is important to find ways to manage stress, such as meditation, deep breathing, or yoga. Get enough sleep. Lack of sleep can raise blood pressure, so it is recommended to aim for 7 to 8 hours of sleep per night. Monitor blood pressure regularly. Regularly monitoring your blood pressure at home can help you keep track of any changes and make necessary adjustments to your lifestyle. Take medication as prescribed. If you have high blood pressure, taking medication as prescribed by your doctor can help lower blood pressure and reduce the risk of complications. In conclusion, high blood pressure is a common and serious health condition that can increase the risk of heart disease, stroke, and other health problems. However, there are many lifestyle changes that can help lower blood pressure, including regular exercise, maintaining a healthy weight, following a healthy diet, reducing sodium intake, limiting alcohol, and quitting smoking. It is important to regularly monitor your blood pressure and work with your doctor to develop a plan to manage your blood pressure if needed. Remember that even small changes to your lifestyle can make a big difference in lowering your blood pressure and improving your overall health. If you found this information helpful, please consider subscribing to our YouTube channel to receive more helpful tips and advice on how to improve your health and well-being. Thank you for watching and take care.